In today's video, I'm going to give you an explanation what is the best natural vitamins that really can help you to control blood pressure. Blood pressure, and this is especially important for the woman after 50 years and older, is the number one silent killer in the modern world. You can have those high blood pressure for the many years and suddenly you will get heart attack or stroke and any kind of similar condition. That's why it's so important to listen to today's video. High blood pressure or hypertension is often called a silent killer because you might feel fine while damage is quietly happening in your blood vessels, your heart, your kidneys, even your brain. Over time, elevated blood pressure puts stress on artery walls, cause them to stiffen, can lead to plaque formation, increases risk of heart attacks, strokes, kidney disease, and more. For women after menopause, risks are higher because protective effects of estrogen lessen and may other risk factors tend to accumulate. So in this video I want to understand why hypertension is so dangerous, see where the thing stands in the US especially for 2025, and then introduce vitamins that play a crucial role in supporting your heart and the blood vessels and really can protect your heart in a good quality natural way. I'm working for the patients for the last 25 years, especially for the nutrition and natural remedies, and those are my suggestions in today's video. So let's talk about it. Latest US statistic of hypertension for 2000 to 2025. Let's take a stock of how widespread high blood pressure has been and how it's changing over time in the US. According to the recent data 2021-2023, about 47.7 US adults have hypertension. Prevalence increases with age. For people over 60 and older, it's about 70.1 have hypertension. Among those, a relatively small fraction have well-controlled blood pressure. About 22.5% of US adults with hypertension have their blood pressure under good control. Going back to 2000, prevalence approximately 47% in that period. Then it dropped somewhat in mid-2000, but in recent risk it had crept back. Also, hypertension contributes to many deaths and serious chronic disease, raises health care costs, lower quality of life, increases heart attacks, strokes, and heart failure risk. Those numbers tell us hypertension is extremely common, especially in other adults, and many people are unaware of it. But when you get aware of it, usually you don't take any kind of medical advice about nutrition and natural remedies. You take only medical advice about taking chemical medication each day, and that's why many people die of strokes and a heart attack, because you use those kind of medication 10-20 years, and after those kind of period you totally avoided nutrition, natural remedies, and natural remedies. That must be the number one reason why you will be healthy or control blood pressure. But of course 99% of people avoid this completely. You just take one pill a day and you will think you have blood pressure under control, and after a couple of years or more the serious condition arise. Now let me introduce vitamin E and why I believe this is one of the most important vitamins when discussing prevention of and support of high blood pressure. When I say vitamin E, I especially mean d-alpha-tocopherol, natural form of vitamin E, in an emulsion format, which may improve absorption. I suggest to start in dose 100 international units per day for 1 month, then gradually increase under medical supervision if needed. This vitamin supports heart function, helps protect artery walls as an antioxidant, and may help prevent formation of small clots or damage from oxidative stress. But you must be very careful if you are taking blood medication or other medication for blood pressure, for example anticoagulants or drugs that thin the blood, because vitamin E has some interactions. Always consult your doctor. Probably your doctor will not understand what is nutrition and natural remedies, but you must be really aware if you have already high blood pressure and if you take those chemical medication, how you use nutrition and natural remedies and specific vitamins. That's why you need good qualified medical professionals that understand nutrition and natural remedies and that understand classical medicine. What is d-alpha-tocopherol and what is an emulsion? Before we go further, let me explain those terms so you understand what you are choosing. D-alpha-tocopherol is natural form of alpha-tocopherol, one of the 8 forms of vitamin E. It is more biologically active than many synthetic forms. It's also labeled as DX-tocopherol and tends to be better absorbed. An emulsion is formation when tiny droplets of fat oil are dispersed into water or vice versa, often with emulsifier. This can improve how fat-soluble vitamins like vitamin E are absorbed in the digestive system. Especially in people who fat absorption may be less efficient, emulsified form may be gentle and more bioavailable, and that is unbelievably important. So that's why I always recommend you use those vitamin E and emulsion form each day. It's really going to protect your heart, it's going to protect your blood vessel and find good quality d-alpha-tocopherol is crucial for controlling your high blood pressure in the safe and natural way. I would recommend using vitamin E from my experience and from the literature, but remember, get medical approved, especially if you are under medication. Phase 1 is 1 month. Usually you will need 100 international units per day or d-alpha-tocopherol emulsion. See how your body responds. Check with interaction. Take with a meal containing the fat for better absorption. Phase 2, if it's not contraindicated and under sufficient, gradually increase to 150 or even more international units per day for maybe several weeks or maybe 1 month. Only if it's safe, monitor blood pressure regularly, watch for any bleeding risks if you are anticoagulants or using other medication that thins blood. Safety caveats: vitamin E is fat soluble, it accumulates more than water soluble vitamins, so risk of excessive intake is real. High doses may increase the risk of bleeding, especially in those on blood thinners or with blood clotting disorders. Always check with your doctor if you are hypertension medication, anticoagulants like warfarin, liver disease or bleeding disorders. Emulsion form may be absorption better, and that's why I always recommend you. Those are recommendations in supplements form, and for the last part of the video I'm going to give you a list of vitamin E food that is you can take it each day, and this is probably number 1 way how you can accumulate good quality vitamin E in your body and prevent high blood pressure. Those food that really can help you. Here are 20 foods rich in vitamin E and suggestions how to include them. Almonds or almond butter, sunflower seeds, hazelnuts, pine nuts, peanuts or peanut butter, spinach cooked or raw, Swiss chard, kale, broccoli, avocado, olive oil, extra virgin, wheat germ oil, shellfish, fish roe, shrimp, tangerines or oranges, mango, kiwi, butternuts, pumpkin seeds, and cotton seed oil. How to use them? A handful of almonds or sunflower seeds as a snack, diesel oil on salad and cooked vegetables. Use spinach, kale, Swiss chard as a side dish in soups or stir fries. Avocado in salads or spread on the whole grain toast. Fruits like oranges, mango, kiwi for desserts or snack. Choose cooking in high oils with high vitamin E, like olive oil, but use moderately because high oil calories increase weight. Including several of those foods daily help maintain good vitamin E levels, support antioxidant protections, and together with a heart-healthy diet, low sodium, lean proteins in the whole grain, you prevent the risk of the high blood pressure, and that is why crucial you will need vitamin E. If you suffer from cardiovascular disease or any kind of disease, if you want to learn how with special program of nutrition and natural remedies can put into control and prevent those kind of problems, call +385 98 9179 200. This is Mario Lab Center in Zagreb, Croatia, and you can use me as your guide through nutrition and natural remedies as I do it for the last 25 years. You can come directly to my office, or you can choose the option of phone consultation. This is especially good for everyone, for people all around the world. Call my office. I will make in special nutrition and natural remedy programs. Even I send best natural remedies directly on your home address, and you can follow my advice on nutrition and natural remedies, how you can in a natural way with any kind of medication prevent heart attack, stroke, on high blood pressure, the worst diseases of modern world, in the safe and natural way. Thank you for following my viewers. God bless you. God bless your family. See you in the next video. Bye bye.